Spinal tuberculosis. Understanding a global challenge. Introduction. Today I will be speaking about spinal tuberculosis, a severe form of TB that affects the spine and can lead to permanent disability if untreated. Known historically as a Pott's disease. Spinal TB is a resurging in many countries including India. So let's understand tuberculosis. Tuberculosis is caused by Mycobacterium tuberculosis, while most cases affect the lungs. Extrapulmonary tuberculosis, particularly spine TB, is increasingly recorded or recognized as a major cause of morbidity. So, epidemiology of spine TB. TB remains a global threat. 10 million new cases annually worldwide. 10 to 15% of the extrapulmonary TB involves spine, high risk group, immunocompromised individual, HIV positive patients, malnourished population, and those living in poor sanitary conditions. Pathophysiology of spinal tuberculosis. The bacteria reach the spine via hematogenous spread. Most commonly affect the thoracic and the lumbar vertebra or spine. Lead to dissection of vertebral body, collapse and potential spinal cord compression. So the clinical features: back pain, severe back pain which is persistent and localized, constitutional symptom, fever mostly in the evening rise, night sweat, perspiration in the night, weight loss. Neurological symptoms are limb weakness, numbness, bladder bowel involvement, complications, kyphotic deformity, paraplegia, chronic disability and dependence. So let's talk about the diagnosis. First is a clinical and imaging. Clinical suspicion is key. Imaging extra shows late changes. MRI is a gold standard for early detection. CT helps in detecting bone destruction. Laboratory tests like ESR, CRP, Mantoux, IGRA and microbiological confirmation via biopsy or pus culture. Treatment principles: anti-tuberculosis therapy, that is ATT, for at least 12 months. Intensive phase followed by continuation phase. Monitoring compliance and response to therapy. So when is surgery needed or required? Neurological deficit, spinal instability, abscess not responding to drugs, decompression and stabilization procedures like laminectomy or instrumentation. So let's discuss one case study. A 32 years old female with backache and leg weakness, diagnosed via MRI and biopsy, treated with anti-TB treatment and posterior stabilization, now walking independently. So prevention, early detection and complete treatment of pulmonary tuberculosis, BCG vaccination, public awareness and improving healthcare access. So emerging challenges, drug resistant TB strain, that is MDR-TB and XDR-TB, co-infection with HIV, need for newer diagnostic tool and shorter treatment regimens. So future direction, research on host pathogen interaction, role of newer imaging techniques, global global collaboration to combat TB through integrated program. So while concluding, spinal TB is treatable and preventable. Early diagnosis, effective therapy and patient education are crucial. Together we can reduce the burden of this disabling disease. Thank you.